And now, Wellness Wednesday, sponsored by ExpressCare Urgent Care Centers, a LifeBridge health partner.
All right, ladies, this one's for you guys. If you're dealing with low energy, mood swings, stubborn weight gain, brain fog, poor sleep, or just not maybe feeling like yourself anymore, you might be a great candidate for hormone replacement therapy.
In today's Wellness Wednesday, we're joined by Andrew Hodge, who is the physician assistant and director of Wellness at ExpressCare Wellness Center, to discuss women's hormone replacement. Thank you so much, Andrew. You always come in and you bring us a lot of information and a lot of help for folks who are dealing with certain conditions.
Well, thank you. I'm happy to be here.
Yeah.
So tell us about this one. We're talking about hormone replacement.
Yeah, so, you know, it's obviously a big topic. It's got a lot of attention, and I think in medicine we're starting to take a shift and bring more attention as it should. You know, and the biggest reason women are experiencing a number of symptoms as they go through this, and unfortunately previously a lot of that was kind of neglected or thought, you know what, you're getting older, you know, you might need to deal with your stress better or get better sleep or better exercise. But there are physiological changes happening in these women's bodies that need to be addressed.
Yeah, we mentioned some of those symptoms before, but can you talk about some of those red flag symptoms or some of those key things that you say, okay, maybe I do need to see somebody?
Yeah,
okay.
So, you know, there's the typical, you know, vasomotor symptoms you hear about of hot flashes and night sweats, but also there can be sleep disturbances, weight gain, incontinence, constipation, brain fog, increased urinary tract infections, vaginal pain or pain with intercourse. These are all things that can be symptoms of perimenopause.
So how do you work with a patient to determine maybe what options are best for them?
Yeah, so, you know, when we mention hormone replacement therapy, essentially what that means is we're talking about, you know, replacing an estrogen replacement or possibly a progesterone or maybe even a testosterone. But not every woman needs all of those hormones as they're going through this. So part of the consultation process is we do a deep dive kind of into their symptoms. What exactly are they experiencing? Timeline of those symptoms, you know, changes in their menstrual cycle, past medical history, and then blood work as well. I mean, honestly, the blood work is kind of secondary. It really is, you know, with the symptoms they're experiencing, that timeline, how we're dictating, you know, what treatment options we might talk about.
And when you see your patients, what is the general, like, who would be a good candidate for this treatment process, would you say?
Yeah, I think it's, as we mentioned, the symptoms, kind of any woman that is going through those symptoms. And obviously, as part of what we're talking about with the consultation is, are there any other medical conditions or medical issues that would want us to go in a different direction if hormone replacement was not necessarily appropriate? And we would talk about that. But in most cases, if they're starting to have those type of symptoms, we want to at least address it and see, could this be the cause of what's going on?
So any danger, any risks involved in either the therapy or just letting the condition just go untreated?
Yeah, from a symptom standpoint, it's a big quality of life. You know, for so many years, and unfortunately, there's been a generation or more of women that have been scared off of hormone replacement therapy. You know, either it wasn't offered by the provider, or they were worried about maybe, you know, the breast cancer risk they used to always hear about, or blood clots and that sort of thing. And unfortunately, a lot of that information was a little bit misguided or misunderstood. And we're now realizing that, and more research has come out, you know, over the last few decades, where we realize that these can be done appropriately and done very safely. You know, the breast cancer risk that we talked about, you know, what we now know is estrogen replacement is very safe and has not been proven to cause increased breast cancer rates. That's both synthetic and bioidentical estrogen replacement. What we realize now is some of the synthetic hormones that were typically used as standard of care previously, part of the Women's Health Initiative in early 2000s that had a lot of attention. We're now realizing some of that stuff is what may have caused those slightly increased rates we see, but we don't really use those anymore, and certainly not in my practice, and so it can be done very safely.
Okay. Interesting. For more information, where do we head to?
Our wellness clinic is at the Corey Lake location, and they can go on our website and make a consultation for a free appointment at goexpresscarewellness.com.
All right. Andrew Hodge, thank you so much.
Thank you. It's great being here. Thank you.
Thank you.
Wellness Wednesday on WJZ at 9 is sponsored by ExpressCare Urgent Care Centers, a LifeBridge health partner.